Hi, I'm Christina, the nurse practitioner and owner here at Eternity Wellness, and today we're going to discuss what you can expect when you receive neurotoxin injections. Over the years, I've received many of the same questions about what it's like to receive neurotoxin injections. So today we're going to discuss how you need to prepare for those injections, what it's like to receive them, and then what the post-procedure protocol is like. Now I'm going to discuss with you what I tell all of my patients to do before their injections. The majority of these guidelines are in place to prevent bruising. Avoid all over-the-counter pain relievers except for Tylenol for 1 week prior to injection, as they thin the blood and increase your chances of bruising. Also, try to avoid turmeric and fish oil. They do the same. Don't work out day of. This makes your blood vessels enlarge, thus easier to hit with the needle. Avoid alcohol for 24 hours before and after injections, as it changes your clotting factors, thus leading to more bruising. Remember, boozy equals bruisey. So now let's talk about what your recovery looks like. After your injections, the best piece of advice is just to leave the area alone. Feel free to make expressions with your face, but just don't massage your face or wear a hat that may put too much pressure on the injected areas. Many people are tempted to apply ice over the injection areas, but this can degrade the neurotoxin and prevent it from working as effectively. And feel free to take a day off the gym. Don't work out after your injections. So this is Ashley, and she is going to allow me to show where we typically inject neurotoxins in her face to address forehead, glabella, and crow's feet, as we so lovingly call them. You have a little bit more movement in your face now than you will have in 2 weeks, but when you're not emoting, you're not showing facial expressions, those rhytides, wrinkles, aren't there. So they're dynamic right now. So raise your eyebrows up for me. So we see rhytides here and a little bit over the brow, and then relax, and they're gone. So a lot of people think, oh, I'm gonna look so frozen with neurotoxins. Hers are still pretty kicked in. This is the point where a lot of people like to redose so that it doesn't get to the point where those rhytides or wrinkles are static there when we aren't making the expressions, kind of like that wrinkle in your arm. So she's here for a redose, just to make sure that it stays like this. And we just kind of keep it where it is now. So today we're going to be sprinkling neurotoxin in those areas to relax the muscle contractility to hopefully smooth it out for another 3 to 4 months. So we always start first by cleansing the skin. I use alcohol. If you come in with makeup on, that's fine. I can remove it. Many people are coming in on their lunch break. So I'm going to put these marks on Ashley's forehead just to demonstrate for you how many injection sites there will be for her face, but every face is different. So raise your eyebrows up. So like I said, each one of these dots, raise your eyebrows up again, relax, represents an injection site, not a unit. We'll talk about units later. The product will really only work for a small area, about a dime size in diameter around that injection site. That's why we need so many injections. So this injection will stop the muscle from contracting here. This one will stop here. Frown for me. These here will stop that squeeze together, which causes 11 lines there. And smile big for me. And these here, the spread will stop the sphincter muscle around the eye from contracting in on this corner only. And so some people need more injections under their eye and their bunny line, more around the brow. It just depends on how your face moves. All right, so this is a tool that I let all my patients use during injections. It's just a facial vibrator, and so many people just put it on their jawline or just hold it, and it's just to distract you from what I'm doing up here. Okay, so rest your head back just so you don't wiggle from me, and raise your eyebrows up for me, and relax. And we'll just inject. I usually do about 2 units in each of these spots on the forehead. Now, a lot of people ask, will I bruise? And if you follow the pre-procedure guidelines, you can minimize your chances of bruising quite a bit. But anytime we are puncturing the skin with a needle, there's always a chance for bruising. So raise your eyebrows up and relax. So I always recommend getting injections about 2 weeks prior to any big event, just in case you do get a little pinpoint bruise. It gives it time to resolve. As you can see, she's not really bleeding much. It's really important not to put much pressure on the injection sites after injection so that we don't manually move the product out of the muscle that I injected it in. Another thing people worry a lot about is ptosis, and that is everybody knows it as like a droopy eyelid. And what happens there is, we kind of avoid this area for injections. But if you were to go lay, say, face down in a massage table, or put a hat on that's really tight, or massage your face or do gua sha tools, then you could move this product into an area over here and decrease the movement of the tail of the brow. And so that's a really common concern for a lot of my patients. So we avoid that area as much as possible, and we follow the post-procedure guidelines, and 9 times out of 10, that's avoidable. Immediately after injections, sometimes, which she doesn't have any of this, but sometimes it can look like a red flare, like if you got a mosquito bite almost, on every injection site. Usually that's gone by the time you leave the office and check out, but she doesn't have any of those, and there's no excessive bleeding, so I would be really surprised if she had any bruising. And as you can see, it doesn't really look like anything happened. And so this is a great lunchtime procedure. You can go back to work and no one will know what you did. A lot of people have misconceptions about the products that are available on the market. In this practice, I use BOTOX and Dysport. BOTOX has been around the longest. Dysport was second to market. They're just made by different drug companies. People do have preferences which one they like to use most, but I always suggest changing it up every few injections so that your body does not get smart and break down the product faster. So we may use BOTOX for a couple injections, and then we'll switch to Dysport. Some people feel like one product may last longer in their face or perhaps kicks in faster. It's different person to person and from injector to injector. So if you see me and you get Dysport and you see someone else and you get Dysport, the results may vary quite a bit because, as you can see, placement matters, reconstitution of the product matters, the age of the product matters, and the length of time that you've waited in between your injections matter. So there's a lot of factors that go into the injection itself. Ashley, did that hurt at all?
There's a tiny bit of discomfort, but I wouldn't call it pain.
Okay, great. And that's what most patients experience. Do you have any questions for me?
Well, just one that I can think of. About how long do you think it'll last?
So it'll last anywhere from 3 to 6 months, depending on the dose and depending on your body and how long it takes it to start to move those muscles again. So for most people, at 2 weeks, they will see the extent of what this dose will do as far as decreasing mobility. And then over the course of the next few months, you'll slowly start to see that muscle come back to life and start contracting.
Wonderful, thank you.
Yeah. And you'll start to see results in about 3 to 5 days, but it does take that full 2 weeks for everything to settle in. So that brings me to follow-up. I always suggest booking a 2-week follow-up so that I can assess how your muscles are moving with the dose that we placed. Thank you, Ashley, for letting us demonstrate on you today. And if you're interested in booking your own neurotoxin appointment, read the description below. It'll show you how to do so.